Now moving on, what we are discussing different disturbances in the occlusion that are derived from the development of the dentition. We are discussing the disturbances that occur during the development of the dentition. Now come to the malformed teeth. The malformed teeth, when we say teeth, there could be having disturbances in the crowns, you could have disturbances in the roots. We talk about the trauma during the development of the dentition. For example, you have a child of the mixed dentition, or you may have a child of the primary dentition. You know, during the development of the dentition, first of all, your crown does develop, and later on, your root part is being developed. Okay, so whenever you have the trauma, this trauma can occur during the development of the crown, if depending upon the age of the patient and depending which tooth exactly we are discussing, because you know the third molar is developing very late, the lower incisors are developing very early. So the point is this, that what exactly is the developmental age of that particular tooth. So if we have dentoalveolar trauma during the development of this crown, then this crown will be malformed. If this crown formation is complete and you would be having a same nature of the dentoalveolar trauma, then impact and its influence on the crown will be, there will be no effect and impact. Moving on to the more common condition that occur due to the dental alveolar trauma is the malformed root, and you must hear the word dilaceration. Dilaceration means that there is an acute bend and a sharp bend. Dilaceration means that you have a very acute bend. This bend or in the root is called dilaceration, and this occur, as you can see over this condition, and this occur during the morphodifferentiation stage of the development. I said that is the common sense. If a tooth is congenitally absent, it means that this is a very early stage of the development. That is the initiation and the proliferation stage of dental lamina. If you have this malformed tooth, then this occurred during the morphodifferentiation. This is a very famous MCQs in this occur during the morphodifferentiation stage of the dental-alveolar development.
Differentiation.
So now you have the dental-alveolar impact. Crown formation is complete. The root formation is in progress. The root formation is in progress, and you have the dental-alveolar trauma. And as an impact of the dental-alveolar trauma, this crown is bent like this. Half of the root is formed, and this is displaced within the alveolar socket. What would happen as the whole of the tooth is displaced? Then what happen? The rest of the root will be developed in a malformed position. When I say malformed position, it means
Okay.
that
Okay.
this is disturbed, this is displaced, and the rest of the root formation would be occur in this way. It does has a lot of implication in the endodontics, because the dilacerated, the curved root is very challenging for the endodontist to operate, and as well as for the orthodontist, because your forces, your distribution of the forces would have been completely different as compared to the normal morphology of the roots.